My name is Erica Gilmore. I'm the unit coordinator of the Florian program. I've been in the mental health/substance abuse field for about 9 years. I've worked with all different types of populations in all different settings. I've worked with adults and with children. I've worked in inpatient. I've worked in outpatient. I've even worked in a jail. I've been with the Rosecrance Florian program for about 2 years now, and I find my work with the firefighters and uniformed services to be some of the most rewarding that I've had in my entire career. I think there's something so powerful about working with people who so selflessly help others, and I get a chance to do something to give back to them. Part of the goal of my presentation at the Florian Symposium is to make first responders and uniformed personnel more aware of the struggles that they may be faced with their career choice, things that they might not necessarily be aware of. One of the things that I'm going to be discussing are what's called co-occurring issues. That's mental health and substance abuse. Some of the most common mental health problems that we see or issues that come into the program are anxiety, depression, and even some people that struggle with PTSD. A lot of what we see working in Florian are people that are faced with what's called vicarious trauma or even direct trauma, and we have to work on addressing and stabilizing those issues while they're in the program. So another piece of the presentation is going to be just informing people on how we go about treating those issues, not only in the Florian program, but outside and after the Florian program as well. One of our main goals of the Florian program is to get people stabilized and get them to a point where they're fit and ready to return back to work, but where they have the education and the knowledge and understanding of some of the problems that might arise down the road so they can preemptively take action to resolve those things. Treating trauma and co-occurring issues in the uniformed services community is relatively new. So part of what I want to accomplish in the symposium presentation is to just kind of talk about the trends and the patterns that I've seen working with these people in the past 2 years and kind of share some stuff that might not necessarily be publicly known. Thank you, and I look forward to seeing you at my presentation at the Rosecrance Florian Symposium.